Welcome back to MEALZEE Minutes. This is episode number 4. This is where we deep dive into all things health and fitness. And today I'm back with the lovely Annabel Johnston, who we spoke to previously all about gut health. So what we're going to do today is follow up and go a little bit deeper around the low FODMAP diet, because it's one that a lot of people tend to ask about. So welcome back, Annie.
Thank you, Chris, for having me.
Now, we touched briefly on the last episode about a low FODMAP diet. There's a lot of confusion around it. It's not a straightforward diet. And, from my days in practice, it was quite often a little bit frustrating that we'd have a client that would come in and they would say, yeah, I've got gut issues and the doctor's just given me this sheet to follow. And they're kind of left up to their own devices. And, I'm not blaming the doctors. I know they're really busy and they're trying to just help their clients as best they can. But there's implications for that, isn't there? Like it's not a low FODMAP diet's not something that we should do long term. So, I think you're the perfect person to deep dive and give us a lot more information. What are the pros and cons of a low FODMAP diet, and what do people need to be aware of?
No, we can definitely deep dive into that. I think it's a really confusing term to call it a diet, and it's because it's more of a tool or a resource to identify what foods are triggering people. But because of that, it's been popularized into almost a gut promoting diet or even weight loss relief for some. But it's anything but either of those things.
Yeah.
So what generally needs to happen is somebody is required to have an IBS diagnosis from their doctor or their gastroenterologist. Once they have that, it's important to get in touch with a dietitian that has had training in the low FODMAP diet and in gut health to really identify whether it's fiber or whether we need to follow quite a restrictive diet to work out what particular foods are causing the symptoms.
Yeah, right. So what are the common ones that you come across? What are the common culprits that you might see as the issue?
Common culprits would be garlic, onion, and bread. When I say bread, though, I'm talking about the fructan in bread versus gluten. So when it comes to IBS, it's never going to be gluten, which is the issue. It will be the fructan.
Thanks for clarifying, because it's often, what people will assume. But they should get that tested, shouldn't they? Like they should rule that out first, because it could be a problem, but it's just unlikely to be from a statistical standpoint.
Absolutely. And generally, that's the guidelines around IBS. So we need to rule out celiac disease. And that's a simple blood test to see if somebody has a gene. And if they do have the gene, doing a gluten test. But if both of those are ruled out, then gluten won't be the problem. And it will more likely be the fructan in some of those gluten-containing products.
Yeah. So they've come in, let's assume that they don't have celiac, that they've come in with the common foods that are the triggers. Just to sidestep for a second, where do people get IBS? Like, what are the origins of it? Because it's not necessarily the food. Am I correct in saying that? It's just that it might be the exacerbating factor. Am I right in saying that?
At present, there is no direct knowledge in terms of what causes IBS. However, there are suspected theories of what could cause it. For instance, getting a virus or getting an infection and something being triggered in the gut. Stress can cause it or exacerbate it. It could be poor food habits over a long period of time too, or it could be an interaction between all of these things. But there is no specific knowledge as to what causes IBS.
Well, which is why, it must be so challenging to, manage and then sort of, for the want of a better word, treat, if you like. Like food might be the Band-Aid then, I'm guessing from that. But at the same time, you as a dietitian, are you also trying to get people to work at the potential root cause of it? Like, how do you go about that?
So when I'm doing the low FODMAP diet, we can identify the specific foods that trigger that individual person, but all of the foods are not the same from person to person. So that's why it's really important to do it and do it properly. But once we know that, then we can create a bit of a guide in terms of foods that they need to actively avoid or foods that they just need to have in a lower dose and work around that So really making sure that we're keeping the diet as open as possible, but limiting the foods to their specific dose so that we aren't causing those symptoms like bloating, pain, or abnormal bowel habits.
And so how long do they have to restrict a lot of these foods, Annie?
So for a person, it could range between 2 weeks to 6 weeks. Ideally, we want to get them to a point when they're not feeling any symptoms. So that's phase 1. Phase 2 is testing each individual food category. And depending on the person, that could take approximately 6 to 8 weeks to get through. And then after that is phase 3, where we open up the diet. So we've worked out what the triggers are, and then we're modifying a bit of a plan so that they can go and lead a life where they feel safe and confident in knowing what foods are going to trigger them, and then how to navigate those situations to choose options that are going to support their gut health.
So yeah, it's quite a lengthy process, isn't it? Which most people go to a health professional or a doctor, I'm thinking, and they're looking for sort of quick results. But I guess, again, if they get results within that first restriction phase, that's incentive for them to keep coming back, that they're onto something. Is that right?
Absolutely. And you're right in saying that it is a lengthy process, but it is the quickest strategy we have to identify what's causing the pain and then getting them back to a life where they're free from that.
Yeah. Yeah, because it's debilitating, isn't it? Like having seen clients over the years, like, and I'm drawing conclusions or assumptions a little bit, but most of the clients I saw were women rather than men. Like I certainly saw men, but I had some horror stories of like they can't concentrate at work, and I don't know if any studies have been done, but what is the cost to society when people are sort of just hiding these symptoms and putting up with them all day long? So it truly is a chronic condition, isn't it?
Yeah, and it increases the rates of anxiety and depression too, because of the stress that's associated with the pain, taking time off work, not knowing where there are toilets, feeling uncomfortable to go, holding on. So all of these extra pressures around having this condition as well, that is a big cost to themselves and to society.
Yeah. It must be rewarding then, like once you get a client and you get the results for them, like just seeing their improvement in quality of life. What about the people that, let's say they've excluded food for, the low FODMAP foods for say 2 to 6 weeks? Do you get many that aren't getting much results at that time? And if so, what do you do with those more challenging clients?
So most of the clients I've seen have had positive results, but the studies do show that about 30% of people won't experience relief through the low FODMAP diet, which is similar to medication. So it's the same. It has the same efficacy as medication. In that particular case, it would be following or getting in touch with a psychologist who specializes in gut health, because sometimes it's about the brain to gut communication and managing the thoughts and emotions around that. So that's the next step after the low FODMAP diet.
Yeah, right. Okay, and it usually comes after. Can they do it concurrently with it, or does it matter, or do you typically do it?
Yeah.
I suppose it's probably
sorry.
I suppose it's probably a burden, isn't it? Like they're seeing a dietitian and seeing if they're doing all that at the same time, it probably is a challenge. I agree. Yeah.
Definitely in terms of time and cost, but it would have a benefit regardless.
Yes, yeah. Now I think we've got about a minute left. I didn't see the time necessarily when we started, but I just wanted to quickly get into the challenge part of it. Okay, so I've excluded food. I'm ready to start challenging food, and then how do I introduce it back into my diet?
So with the help of a dietitian, we have specific lists. So let's say we're testing the fructan category. For 3 days, we're going to test something like onion, and we're going to increase the amount over those 3 days. While we're doing that, we're recording how we're feeling, our symptoms, everything that's going on. And as soon as we start to see symptoms, if they're somewhat bearable, we continue to the next day. If not, we stop, we record it. We have a 3-day washout period, so not having any foods containing FODMAPs, and then we move on to the next challenge. So it's a very systematic process to identify exactly what is triggering our symptoms.
Okay, great. Yeah, I guess you've got to be like that, haven't you? Because any seed of doubt, did I consume something that may have contained, X, Y, Z? Yeah. Okay, well, I think we're pretty much out of time, Annie. We may have gone slightly over 10 minutes this time. I'm not entirely sure, but I will give MEALZEE a little plug here, because something that we're doing with there's low FODMAP recipes, but I'm going further in that we can break it down into the individual FODMAPs. So this will be a change over coming months where, if they have excluded certain FODMAPs but others are safe, you'll be able to exclude individual FODMAPs so that the other ones come back into the plan. Does that, from a dietitian perspective, sound like something that, could be useful? Because that's the problem, isn't it? If we're excluding too much food, you kind of left, people can feel left like, there's just not many options. So I'm hoping that helps anyway.
That is a wonderful idea and will help so many clients.
Yeah, there's a fair bit of work in it, but I knowing having seen what clients have to go through once they've worked out what they can and can't eat, it is a bit of a blanket diet that they're left with sometimes. So, all right, Annie. Well, thank you again for your lovely insights. I appreciate your time. And if anyone wants to get in contact with Annie, the Instagram link is down there at the bottom, and you can contact Annie there, and she's happy to help you out in Brisbane. Oh, you do online as well, I imagine.
I do online, yeah.
Okay,
but also in person in Brisbane. Yeah.
All right. So no location restrictions, but if you're in Brisbane, you get to see Annie in person. All right. Thank you, Annie.